I absolutely loved talking to Pauli. She is so much fun. She is just a wealth of information. So, Pauli is Pauline Hannon. She is a pelvic floor PT and also a coach. So, she mainly helps women, but also men with their pelvic floor strengthening. We talked about trauma and all the things that impact our health. She's just amazing. So, you can find her on Beyond the V. So you can find her over on Instagram, Beyond the Bee, and then also on her website. So I hope that you enjoy this episode as much as I enjoyed talking to Pauli. So, Pauli, I'm so excited to finally connect with you. And I want to learn all about my pelvic floor and how to help my pelvic floor because I had 2 kids and I had C-sections, but that didn't matter. If I sneeze, I pee. That's my motivation. But I know there are other things. So I'm excited to learn from you.
Great. I'm excited to be here. I love talking about this. I would talk about it all day if I could.
It's good to have work that you love like that. That's amazing. So tell me, so for people who are just like, I don't understand what the pelvic floor is, what it does. I mean, we all have a pelvis, so we should understand that we have a pelvic floor. So tell us just some basic stuff about our pelvic floor and why it's important to support our pelvic floor.
So the best way I can think to describe the pelvic floor, and I'll even say this before, this is the way I'm going to explain it. It's not going to do it justice in terms of how complex it is. So if you can imagine that you're looking at your pelvis, those muscles, they start at the pubic bone and they wrap all the way to the back. They attach to your tailbone, they attach up into your sacrum, and a lot of people will describe it like a hammock. But there's 12 muscles, there's 3 layers. Another way I like to describe it is so if you think about if you're going from the outside in via the vaginal opening, you're going to walk through a door into a hallway into a circular living room. And as you're walking through those, when you go through that doorway, the opening, that's your first layer. When you're in that hallway, the floor, the ceiling, the right wall, the left wall, that's your second layer of pelvic floor muscles. And then when you walk into that circular living room, the flooring actually will go up into the wall, kind of like those houses in the 60s and 70s that had carpet that went up the wall, similar to that. That's your third layer of pelvic floor muscle. So, and while you're even in there, I'll just even add, there's a love sac in the back of that living room, which is your rectum, the art on the back of the wall of that room, that's your tailbone. And then if you look up at the chandelier, that's your uterus. And then if you turn back around, right, because we kind of walked ourselves in, if we look up, our bladder is tucked up into the loft, kind of like an HVAC system might be in our ceiling. And so I feel like really understanding, like my word, we have all these different layers and all of them participate to do a number of different things. So that's how I would describe the pelvic floor, how it is. If I even went further to say what it does, it participates in sexual appreciation. It allows us to have babies. Those muscles lengthen. It allows us to have control over our bowels and bladders, whether that's being able to comfortably evacuate our bowels or empty our bladders, but also being able to squeeze against our urethra or our part of our rectum so that we're not leaking either direction.
Right.
It also participates in support in our pelvic organ, so nothing is falling out, if you will, but it also plays a really big role to help support your pelvis and your hip joint. So that's kind of an overarching theme of what the pelvic floor does. And I could get into the nitty gritties, but I think that
that pretty much tells it. Yeah. So, and you work with women, that's mostly, but men have a pelvic floor. I just didn't know if they need to be worried about theirs or if it's just us women that need to be.
Yes.
We don't want anything falling out. That's
yes.
or leaking. So.
Yes, of course. Yeah, you're right. Men have a pelvic floor. I do work with men in my in-person clinic, and I work with kiddos too. Obviously, the approach with a child is going to be very different than a woman or a man. But yes, the way that the male pelvic floor is set up it really is the same as ours, except there's one less opening in the male pelvic floor, and the orientation of their pelvic floor muscles are a little bit different because of how their genitalia sit. So
right. But so most of the people who come, are they why are they coming? What do they need?
Most of the time I see women, and typically it's for issues that have come after having babies, or maybe even in preparation for having babies. And most of the time it's pain with intercourse because of scarring after having a baby. Sometimes even before they have children, their pelvic floor can be a problem on that front. After they have kids, I feel like there's a number of different reasons they could come in. Like I said, pain with intimacy can be one of them. Having prolapse, where any one or two or three of their organs might start to head towards or even start to fall out that vaginal opening. A lot of women just don't feel strong. And whether that's because they're leaking and they don't feel ready to return to exercise yet, or they're too nervous to, or even just, man, my body doesn't feel like it did. I used to exercise and I exercised a lot, but I'm just having a really hard time returning to what I used to be able to do. So
Right.
it typically falls somewhere in there. And then, of course, diastasis recti comes up a lot. I feel like that's kind of a buzzword on social media, but that's typically that comes up somewhere in there because it does play a role in your pelvic floor and how it functions.
Right. And the men are coming for
The men are coming for leakage or pelvic pain. So
okay.
it's really, men historically and stereotypically their muscles just tend to be tighter, and that pelvic floor will follow suit. So one of the things that I often will say, and I feel like a broken record, whether we're talking about a male pelvic floor or a female pelvic floor, is whatever the hip does or doesn't do, it decides what the pelvic floor does or doesn't do. So if you have really tight hip muscles or hamstrings, like I feel like it's kind of a running joke in our home about how tight my husband's hamstrings are because he can't bend over to touch the floor or something. And I always will joke with him. He'd probably lose it if he knew I was saying this, but I would say, oh yeah, if your hamstrings are that tight, I bet your pelvic floor is probably problematic. And he'll say, oh, don't talk to me about my pelvic floor. But that premise is there because if those muscles are tight,
Yeah.
that pelvic floor is going to follow. And so that's what I see a lot, is that the pelvic floor in a lot of men are very tight in relationship to what's happening at that hip or that pelvis. It can bring on pain with intimacy and all the different parts, or even just sitting or laying down or limiting their exercise. It can be a number of different things, but leakage as well is another reason that they might come in.
Right. So lots of reasons that we need to be really paying attention here. And I would imagine that a lot of people have just been like, well, this is what I mean, I'm getting older. I guess this is it. Or they don't even realize that there are things that they can do that are simple. Cause
Right.
I've learned some of these things too. I've been watching some of your work, and I know you've got a podcast, you've got an Instagram, so that people, and do you work with people? I know you're in clinic. Do you work with people virtually too? I can't remember. I
I
thought so,
do. Yeah.
right?
Yes, I have some coaching options. I have some online programs where I don't
Right.
even
Oh, that's
necessarily
right.
need to work one-on-one with anyone. So it just kind of depends on what their goals are. I don't know if it's a mistake or not on my end to have a bunch of different options to choose from, but I have tried to consider what people have asked for over the years and how I can really best help and best serve them, because I just think it's ridiculous that there isn't more help and there's not more talk about, because it really is relatively easy to take care of.
Yeah.
It's not a big, and I don't want to throw cancer under the bus here, but
Mhm.
and they're, because they're not the same at all. But to fix your pelvic floor and any issue or symptom that comes with it, it is relatively easy. Cancer is a whole nother ball game. And it's just one of those things that I just think like, well, how do you change a light bulb? There's tons of, it impacts your life, even though it's so silly. And while it may not be the best analogy on that front, but it's just, to me, it just seems silly that we just can't get the help that we need and then move on with our life because we have so much better and greater things in store for us, rather than worrying about or being affected by how our pelvic floor is influencing us.
Right. I agree. And when you realize like how simple it is, I think having lots of options makes sense to people, because where they need to engage, there are different ways that people can engage and learn and start doing things, right?
Mhm.
So I had a couple thoughts too. I was like, how did you get into this? Because yeah, your physical therapy, and then what in the world made you think, hey, I think I want to do pelvic floor work with people?
Well, so before I went to physical therapy school, I worked at a physical therapy clinic as an aide. And I knew I always wanted to be a physical therapist. And I had this, if you want the whole long story, you can go listen on my podcast. I won't bore you with that here, but I had this introduction that women's health was a thing because this new grad that just came out of physical therapy school seemed to know all of these things about the female body that to me seemed like a doctor should know, not that a PT should know. And so it was on my radar. And when I went to PT school to start, I thought I'm going to be a pediatric physical therapist.
Uh-huh.
And we did our first experience, and my professor kept saying, Pauli, you need to do therapy. You're being a mom. You need to quit that. And it's funny looking back because even as a child, my mom in all of the home videos, she would say, quit being the mom. You're not the mom.
Uh-huh.
And so in that moment, I realized, oh, well, I want to do a good job. However, I'm going to be a PT. And then I remembered this encounter and experience that I had with this new grad in that clinic. And I thought, I'm going to go look into that. And so I was really fortunate to go spend some time with a PT who did post mastectomy care, cancer patients. And those women were so lovely and so energetic, and they loved life and so positive. And I thought, okay, well, if I'm going to leave my family, that's who I want to be with. So I got lucky that one of my first rotations, or one of my rotations in Baton Rouge, Louisiana at the women's hospital, I thought I was going to be doing post mastectomy care there as a women's health, physical therapist before I graduated. And I was actually wrong. There was no post mastectomy care. It was all pelvic floor. And within the first couple of days, I remember calling my mom saying, get me out of Louisiana. I cannot be here. It is so inappropriate. We're talking about your sex life. We're like, no, get me out, mom. I can't do this. And my mom would always say something to me like, well, just buckle down and get to work.
Right.
And so when and I remember just listening to these women's stories, and again, that same idea came to me. Well, man, these issues are really affecting their life. It's not just, oh, they can't exercise. It's affecting their marriage, and it's affecting their ability to participate. This one woman wanted to go watch her grandson graduate from Tulane, but she couldn't because she knew that she would end up leaking everywhere because she went through so many pads in a day.
Right.
Well, dang, all we got to do is get her pelvic floor strong, and she should be able to go watch her grandson graduate from med school. So that's how I got my start. And there was a moment when I heard a voice, and it said, "This isn't about you, Pauli," and that's when it really hit
Uh-huh.
home for me. And so that's what I have been doing ever since. I've done a little bit of orthopedic from here and there, but the
Mhm.
pelvic floor has been my love. I don't know if I can say
I
that.
know, yeah, that's amazing. Okay, so I'm like getting teary. I've got goosebumps because I love how life does this to us, especially the places where we're like, absolutely not, no way, I'm not doing this, get me out. And then it becomes the thing that you need to do the most. And I've heard that same voice. This is not about you, Kelly. Like, and I was just saying yesterday, I have been a mama. I've been a worried mama before I was a mama. Like that's just who I've always been, is I'm the mama. And so I think to use that can, when you want to work with children, same, but when you need to sometimes back up because you're not the mama. They
Right.
have a mama. So
Right.
yeah, so to use that because that's nurturing and loving and all of the things and concerned about people and their well-being, but also they already have a mom. So
Right.
yeah, so we can use that to our advantage, but also just that might not be the best place for us. And I just think that's amazing. I love stories like that where it's just not what you expected. So to me, that's soul. That's like the soul's doing what the soul needs to do, and that
Yes,
our life just leads us where we need to be, whether we like it or not.
true.
Yeah, right? I think it's so funny. And with when you had reached out and said, "Hey, I'm like, this is what I do." And I was like, "I have been thinking about my own pelvic floor and really needing to work on that." So that was good timing for me too. It's just the universe has good timing. But I was doing Kegels because I mean, what else? That's all you ever hear, right? So when I learned like you can go like is it bad to be doing Kegels or we just need to be going beyond Kegels?
I think we need to do more than Kegels. And the way I explain it all the time is I I feel like I probably come off as like I hate Kegels and my online brand is called No Kegels University. But I also think is again really understanding how that pelvic floor works.
Mhm.
And I just, just a little bit ago I told you about how complex it was and all these things that it does. And so to say that all we need to do is isometric contractions, where we just like squeeze and let go and squeeze and let go. Well, we don't strengthen any other muscle group that way. So why are we taking this pelvic floor, this important muscle group? Yes, I might be biased, but it needs more than that.
Yeah.
And I tell a lot of my female patients, because I work with so many women, you're a mom. And while you may not feel like you're an Olympic athlete, think about the physical activity that you do during the day.
Mhm.
And the story I like to tell is there was one day I was trying to, the dogs wouldn't get off the food because one of my kids had dropped it. And then like a couple, right? So I'm like pulling the dog and we have big dogs. And then a couple minutes later, both my kids were going at it and punching each other. And so I'm pulling them, which made one of our other dogs like really excited and wanted to jump in the middle. So I'm, like I'm squatting, but I'm reaching, but I'm also like holding weight up over my head. We need to do a whole lot more as women. Yes, men too, of course, but we need to make what we're asking of our pelvic floor and the rest of our body to a higher level than how we're training. So I don't necessarily dislike Kegels. I just don't think it's not serving us in the way that we need to
Yeah.
be strengthened. We need a lot more than Kegels.
That's what I was, and I had read a little bit too that if you might be doing it incorrectly or that it might
True.
even not be working on the right thing, and so what
True.
you think you're doing is not even helping you. And so
So
I was
true.
like, well, all right then. Let's so it's not that it's necessarily bad, it's just that you might be doing it incorrectly. And it's I I can't even tell you how many times I can picture myself too with the dog sliding in with something on his rear end and you're doing that and you've got to get up here and it's just all the things that you need to be able to do and the flexibility that we need to be able, and you don't need to be leaking anything
Right.
um,
Right.
or anything falling out or any of those things. And a lot of the questions that I get too of people in menopause or in that phase of life of around intimacy, and I just wonder how much that they're not enjoying things like they used to. And I'm wondering
Right.
how much of that is pelvic floor because they think it's age and they think it's because, we're hitting menopause. And I'm like, I don't think so. But what do you think?
I think you're absolutely right. And just like really understanding what the pelvic floor does, I also think understanding the environment. So I don't like to use, the O word or the A word as we get older or age, but as we acquire a few more birthdays, our vaginal pH starts to change a little bit. So when we're younger, I think it's about mid 40s is when it starts to become a little less acidic,
Yeah.
but it's still something to consider that environment is very easily disrupted. So if we're using hygiene products that maybe aren't organic or have extra fragrance or washing with different soaps, we might be influencing the pH in the environment, which can change how our tissues function. Also, depending on your hydration status, which of course, as we age and get older and acquire a few more birthdays, our desire to drink more water and to stay hydrated, it gets a little more difficult. So the hydration status can really influence how those vaginal tissues are. And the other piece that I'll recommend, just because breast cancer is it's so common and so many women are nervous about it. They don't like using a topical estrogen cream, although can be really helpful. It's a little more expensive. It requires a doctor's prescription or referral for that. But a vaginal moisturizer can go a long way. And so I feel like getting a good vaginal moisturizer can
Mhm.
make a huge difference to those tissues because all those vaginal tissues, and even internally as well as it relates to intimacy, they house all of our nerves. So if our nerves are
Right.
irritated and annoyed and there's not enough padding or integrity of those tissues, it's not going to be enjoyable, and it's going to feel like, yep, I'm just getting older. It's my body's not working anymore,
Mhm.
rather than understanding what's happening down there and how you can just do a few extra things to kind of help coax your body to adapt to those changes. And of course, I'll throw in that having strong muscles will, of course, enhance that experience as well.
Yeah, and I'm just thinking about the psychological piece of this too, because we tend to
That
think,
too.
oh, well, that's just it's I don't know what we think, but it's all related because I'm hearing you. I'm like, yeah, I talk to people about their hydration status. And I think about if things are padded and moisture and feel good and you feel strong, like then you're going to want to psychologically, you're going to feel better and you might have more
Absolutely.
motivation to do things that feel good, right?
Of
So,
course. Of
right.
course.
So that, yeah, that makes sense to me. Anything else that comes to mind for you around that?
I don't, I think women would be really surprised
Yeah.
that strength and hydration and a vaginal moisturizer can really influence vaginal environment much more than what you think. I have a couple of patients right now, and they come in every time and they say, "Ah, I don't even know why I'm here." And then I'll ask them, well, how's intimacy going? Oh yeah, it hurts less. Oh, okay. Okay. So and I think to them, their brain is just still stuck on the fact that, oh, yeah, this probably isn't going to work. But when we get to the heart of it, the real reason they're coming in because they're having pain with intimacy and their husband is interested, but they're not anymore. At the heart of it, that psychological component still is kind of limiting them. But I think women might be surprised how much of a change that would give them
Right. I
to those
agree.
things.
I mean, I'm with you on that. I think that that's so how do people make sure they get a good vaginal cream if they're going to use that?
Well, one of my favorites is by a company called Intimate Rose. It's called Enchanted Rose. And one of the things that I'll say when I look at these vaginal moisturizers is what's in it
Yeah.
and can you understand it? In this particular Enchanted Rose, I like it because of the consistency. I actually used it on my belly for my stretch marks during both pregnancies. It's really moisturizing and hydrating, but it doesn't leave, like lubricant sometimes will leave that sticky residue. It
Uh-huh.
really absorbs into the skin, but it's not greasy or there's not any residue left. So that's my favorite. Um, which I can give you a code if people want a few dollars off. I have a code, save you a few
Yeah.
dollars.
Yeah,
But it
absolutely.
lasts for a long time and it's also organic. And when you read the ingredients, it's, oh, I mean, maybe you don't know what calendula oil is, but you can at least, oh, okay, it must be an oil of some kind. It's
Mhm.
not these long scientific words. That's kind of what I look for. But also everyone's vaginal environment's a little bit different. That one's my favorite because I've never had anyone have an issue with it like I have had with others.
Got it. Yeah, we definitely want to put your code up for so if
Yeah,
people want to check
save you
that
guys
out.
a few bucks.
Yeah, so I can do that on the video, but I'll
Okay.
put it in the show notes too. And we'll make sure that people can get the codes if they want to get that. Yeah. So is there anybody that wouldn't work for them or you think like super sensitive people? That one seems to be a good one.
I'm trying to rack my brain. I One of the gals I have right now, we have to be really careful about just even the lube that she uses at home and then the lube that I use in clinic with her has to be a specific one because of sensitivity. I've never had anyone have an issue with that particular one. And I think that company is ran by a pelvic floor physical therapist. And so she has a lot of insight to what goes into the products as well. I can't think off the top of my head anyone has ever had a problem. Some of my patients have even just used it as lubricant as well
Mhm.
because of the consistency and how it absorbs.
Okay. And then, but how often would people want to be using that?
Oh, I tell my patients and coaching clients, try it once every other day, just to see how you tolerate it, and be mindful that you're not adding anything else into your regimen just so that we can see how those tissues respond.
Right.
Because I think sometimes we, want to go at it with everything we have rather than saying, okay, I'm going to do one thing for a week or two and make sure that my body is responding well. And so that I know that this one thing I'm trying is actually making a difference. Once a day, every other day for the first week or two. And then you can either, titrate down and maybe do it once every 3 days or just a couple times a week, and just really however is needed. I don't think it's something where, like, our face and our body, we need to moisturize all the time.
Right.
It's an area I think we kind of neglect.
That's true. I think we do. It's sort of like, especially if it doesn't feel like it's working right. Like
Of
you just
course.
like leave it like just forget about it. So that could be an issue. And I know the simple things that people can do. Do you want to talk anything about any of the exercises that people could do? They really just need to come see it.
Oh, yeah. No, I'm happy to share. So a couple years ago, I tried to put this together in a succinct way to explain my method of how to
Yes.
see if an exercise is a pelvic floor exercise or a pelvic floor strengthening exercise. So I'm happy to share it. And if you want to DIY it yourself, have at it. So the way I like to explain how to figure this out in terms of pelvic floor strengthening is the VAB3 method. VAB3. So V stands for vertical, A stands for above, B stands for below, and 3 stands for all 3 planes. So vertical being, and I'll preface this, the way in which I've pulled this together, this is how our pelvic floor works naturally and physiologically. And rather trying to reinvent the wheel, let's use what it's supposed to be doing to our benefit for strengthening.
Mhm.
So vertical is our pelvic floor contracts anytime we have like an up and down motion or vertical. That's its job. So if you think about before you had kids, or maybe even when you were young, you could jump on the trampoline, no problem. Why? Because your pelvic floor would squeeze against that urethra, so you had no leakage. So vertical, doing vertical motion of any kind, can be a way for strengthening. A for above. This one's a little more difficult to add in, but I like to add in weights overhead or just even reaching overhead, where we have something happening above the pelvis
Mhm.
to encourage different movement and dynamics, so that pelvic floor is having to show up a little bit. And I'll give an example at the end. B is for below. I mentioned this earlier, that whatever the hip does or doesn't do, it decides what the pelvic floor does or doesn't do. But the cool thing is that our hip, our knee, our foot, our ankle, all that is almost like a domino reaction. So if you're doing a leg exercise, your pelvic floor is probably showing up. And then 3 is for all 3 planes. We are 3D people living in this 3D world. The pelvic floor is the only group of muscles that have fibers that run in all 3 planes. So if I think the most important, well, I think the pelvic floor is the most important group just because of this idea and this fact. And so I like to ensure that we're doing something in all 3 planes. So front to back, side to side, and diagonal or rotational.
Mm.
And so so if you were to say, okay, well, if I'm doing this exercise, I would like it to have at least 2 of those VAB3 components, and then you could call it a pelvic floor strengthening exercise. So one
Okay.
of my favorite ones that I like to say, because, and really you can take any exercise and modify it, but a squat is one that an exercise we do all the time. So a squat, that would be B, right, for below, because we're using our hips and our knees and our feet.
Mhm.
But if we wanted to add another component to it, well, we could add an A component above. So we could squat and we could reach overhead at the same time. So
Uh-huh.
as we're doing that, that technically is going to work that pelvic floor. Well, we can even change it a little bit and say, okay, well, what if we added all 3 planes? What's a way we could do that? Well, we could pretend that we have a clock on the wall. And as we squat and reach overhead, maybe to the 12 o'clock position, well, that's a way to do it, like I said before, but then you could stand back up and then squat again, simultaneously reach. So as you're squatting and then reaching, you're going to reach to that 1 o'clock spot on the clock. Stand back up, squat and reach to the 3 o'clock, stand back up, and then you can cross that body, because now you have to hit the 11 o'clock and 10 o'clock and 9 o'clock on that
Mm.
clock.
Mhm.
And so now we have all three planes. And you'll notice that as you're doing this, especially if you're watching or listening, maybe try it. Your hips are not going to be squared up with your knees and your feet, and that's okay. Think about the last time you went to Costco or Sam's Club. None of us look that cute when we're trying to pull that, big case of water or toilet paper or something from the bottom of our cart. We're in different positions. But the beautiful thing is you going to Costco or Lowe's and like pulling stuff from your cart, you count that as work in your pelvic floor too. So that's a way that I like to take what most of us are probably doing. And again, rather than reinventing the wheel, but just using different components from that VAB3 method, you can take any exercise and change it to benefit your pelvic floor.
Right. Amazing. And I noticed for me when I would go to Zumba, like I love to go to, and all of a sudden I couldn't jump without peeing. And I was like, oh, what is this? So I bought a rebounder and I've just
Oh
been
yeah.
getting on the rebounder. And my husband was like, seriously, how many of these have we owned? And I was like, well, we're about to own one more. I think we'll sell it again if we need to. But so just to have some up bouncing, and I've noticed it made a huge difference. So now I can,
Yeah.
and then I can, dance or whatever without leakage. So that's huge.
I love that. I will go to my grave. There's a few things my husband hears me say often, and one of those is every woman should own a trampoline. I said what I said. It is the best thing for us women because for most of us we're scared, right? Like, well, why would we go jump on the trampoline? I can't even show up at Zumba. That's how our body works, but you can do it in a way and then build up from there, which I'm so glad. Oh my word, I'm so glad that you have discovered the beauty of a rebounder or the trampoline.
Rebounder. Yeah. Because I couldn't believe that doing that was actually making it better. I thought it would just keep like it would, I don't know. It was fast too. That's all I wanted to point out to people too, is that
I'm
I had
so
to
glad.
do some emotional work too. So it's not like I was just doing that, but I also realized like with my youngest son graduating from high school, and like there was a lot of mothering stuff coming up for me, and like so I think that probably had a lot to do with it as well. So the emotional piece as well as the physical and maybe even mental too, right? So
You're, yeah, I'm glad you brought that up. That's something that typically comes up for my patients or even online coaching clients when they'll say things like, "Oh my gosh, I was doing so good," and then it just hit the fan. It's not working anymore. And immediately the question I will ask is, "Okay, well, what's changed in your life?" And the interesting thing, and I don't necessarily need to go into super depth here, and I'll sum it up by saying, anytime we experience a negative emotion, anxiety, stress, nervousness, scared, frustrated, any of those, not that I'm really qualified to talk about those negative emotions, but what I've observed is the research backs it up as well. Our pelvic floor actually tightens up in response.
yes.
And so now we have a tight muscle we're having to work with. So I would imagine, I know I'm speculating here, but I'm just speaking in generalities, that really can be an influence for a lot of women, surprisingly enough.
Right. Well, and what I keep being told, so emotions are my business, right?
Yeah.
And so then I'm like, wait, we have to kind of know all of this because our emotions are inextricably connected to our immune system, our nervous system. Like it's not just isolated.
Right.
So, while we're doing things mentally, physically, emotionally, we got to work on it, different things and different levels, I guess. And I'm just thinking about the pelvic floor, the way you described these three layers too. That makes sense to me. Like the way that we work psychologically is in layers too. So
Oh,
mhm.
oh,
Yeah, because
interesting.
sometimes you can't go right in, like,
Ah,
and I always used to tell my students all the time, you might see the front door. Like, this is the problem. There's the
uh-huh.
problem. And you just trying to walk your client straight to the front door, and they're not ready to go to the front door. They don't see it. They're
Hmm.
not there yet. And so you got to go around. I used to say the barn. I don't know why the barn, but like you got to go all the way around the barn until they're like, oh, and you just companion people till they get there. And to me, it's sort of the same. You would start where people can start. And
Mhm.
even if you see like the problem, you've got to start with something else sometimes to get all the way around.
Oh, that's so interesting. I love how you put that together. That is really incredible.
I don't know if it would be the same for a pelvic floor if they're, if you just start where you start, like everybody starts the same, or if sometimes you have to see where people are.
No, you're exactly right, because there's some, which is why I ended up creating a lot of online options and
Mhm.
coaching options, because a lot of women are not okay with doing the hands-on or the internal work, which is totally fine. It's their, they get to make that choice, right? Informed consent. And so I have a lot of patients and online clients who've done really well with having a hands-off approach for the first little while, sometimes even all the way through to the end, just because, like you said, well, they're not ready for the front door, but if we can go around, to a different side of the barn and introduce them here,
That's
yeah,
right.
I'm kind of changing it a little bit, but
I did the
well,
same. Yeah, I'm like,
yeah,
you get around the back and they see the back door, you're like, "Great, that's fine, we're in."
yeah.
I'm like, whatever. I never think I try to anticipate, like that I
Um,
think I know where this is going. But yeah, that makes a lot of sense to me. Some people might be too shy or think it's
mhm.
too intrusive to do something hands-on, and some people might not even have realized till just this second that's what's happening if you go
Right.
to a pelvic floor specialist or a pelvic floor PT, is that you're
Mhm.
going to have a hands-on PT approach to your pelvis. So yeah, that might be a little daunting for some people. Yeah. But I'm wondering, I'm guessing that is ultimately the best approach. Like, I don't know if the best is the right thing. It sounds like some people can heal enough without hands-on, but it would seem that that's kind of like the primo, like what you want to do if you've got a lot of issues with your pelvic floor.
Yes, it definitely gives me more information if I can have a hands-on approach. But like I mentioned earlier, I also treat the pediatric pelvic floor, which is wildly, as it should be, different than treating a female and a male pelvic floor as over 18. And so I thankfully along the way, there's a lot of things that we can do to make an impact without having actual contact with the pelvic floor or even having contact with the body at all. Yes, I would say, like you said, primo, that would be my preference. But I also know that it's my responsibility, because I've been doing this for so long and I've studied for a long time, to really make sure that I meet women where they're at, but also it served me really well in treating kiddos too. And I think we all know that the numbers of sexual assault and rape are very high. And oftentimes that plays a really big role into if women are okay with me working with them hands on, but a lot of times it's hands off. And I'm just saying, okay, well, let's try this exercise and see how your body responds, because there's other ways to test. It doesn't give us the exact clear picture that doing an internal exam would, but just like with kiddos, if they have a tight pelvic floor or they're leaking all the time or they're having a hard time with constipation, we can still get them to a place that they need to without. So yes, I'd say it's primo, but I also think I've taken it really seriously because I have so many women that are in those situations that just don't feel comfortable or safe yet, that there's other ways that we can make progress, like the
Mm,
barn door example in the front door.
right, right. Yeah, I was going to ask about that too. How much of trauma, I would imagine that trauma plays a big role in our pelvic floor, like how we hold ourselves, how we carry ourselves. Not necessarily sexual trauma, but it could be, I mean, I would think that first, but not necessarily. It could also be other trauma where you're just now holding yourself differently. And that could make a big difference in our pelvic floor.
Yeah, that's unfortunately it comes up a lot.
Mhm.
I'm sure you're probably familiar with the book The Body Holds the Score.
Yeah.
And it's and I don't I can't exactly describe how I know this, but even if a patient or a client hasn't yet shared with me a history of trauma, because I don't always ask right away, I just kind of let things go. And I'm very careful, of course, but just to kind of let them see, because you don't need to come in guns a blazing asking all these very intimate details when we just met a couple minutes ago. But the body, there's certain holding patterns that our body does, whether it's at, most of the time it's at the pelvic floor, especially with sexual trauma. But interestingly enough, the body and your nervous system
Mhm.
really can be a tell-all. And not that I'm like trying to be a spy and, get all the tea of, of what's happened in their life. The body, it holds on to trauma, any kind of trauma, in lots of different ways, as I'm sure you're probably very familiar with.
Yeah, but I think that's, if we're just trying to do talk therapy or we're just doing PT, I think we all have to become more and more trauma competent and
Yes.
understand that there are certain things that we would do differently, maybe given trauma, and like just more aware. And we're always going to be very cautious, I'm sure, in the way that we approach, but also the way the body holds it. You start to see patterns, I'm sure,
Mhm.
which is we see patterns too psychologically.
Oh,
So
sure.
in the nervous system, it just makes sense. And it really helps clients and patients to go, oh, like some often they don't think that an uncle dying and it being very sad to them is creating the problems that they're having in their body. Like they don't connect those two things. I think people think, "Oh no, I don't have any trauma. I haven't had, big T traumas or just I didn't have an accident. I don't nobody's been, you know, beat up in front of me like the big things." And they don't
Right.
realize that just some of life, the way that it's not what happens to us, it's how we interpret that and how much support we have. And I would
Sure.
think that the pelvis, the pelvic floor is all about support. And
Mhm.
so if we don't feel supported in our life, or we have places in our lives where we didn't feel supported, I would imagine that would weaken that area. And then you would need to do a little work there to get it strengthened
Right.
back. Yeah.
Right. Yeah, the story I like to tell, because I don't always, again, I don't want to come out guns a blazing talking about trauma as soon as I'm working with someone. But I had this patient and they were transitioning her son, or their son, I should say, from public high school to home high school, just to help him with his habits. And I knew it was kind of stressful. And prior to this particular appointment, when this happened, we just would talk about it in the beginning. But I think she was running late, and so I was like, "Hey, hurry! Let's get ready. We'll just get started." And then we kind of did the, well, how's life? How's your son? How's your husband? Any fun date nights? Like all those, female conversation things. And so I was working on her pelvic floor. I promise I won't be graphic. And it was releasing and it was being very soft and supple like it was supposed to. And then I had said, "Oh, wait, how's the transition with your son? How's he doing with doing homeschool at home?" And it was almost like someone turned a switch and that pelvic floor just tightened right up. And I stopped my tracks because it was so abrupt. And I realized in that moment, my word, there's a lot happening around her. So we spent the entire time, not that I'm trying to be a counselor or give advice, but just to give her an opportunity to talk about it. And I also kind of wanted to see how her pelvic floor responded to, some of the like the frustrating things, or, okay, well, tell me about the positive stuff. And would her pelvic floor start to release a little bit after that? So it was very, that is, to her, that obviously was wildly stressful. But to somebody listening, like, okay, so your kid changed schools, like that's not trauma.
Right.
But to your point,
Yeah.
it
That's
we don't get to
exactly what I'm
decide.
saying.
Yeah.
That's exactly what I was trying to say, Polly. It's like, yeah, and she probably was like, "This is my life. This is what I do." We don't realize how much stress we're holding in our bodies for the things that just are our normal. That's our everyday experience. And it's stressful, but you don't realize like what it's actually doing to your body. So that kind of awareness, I think, is beautiful. to have, to people to be able to connect things in their own body and be like, oh, okay, this makes sense. Right. I love it. So what have we missed? Is there anything you're like, we've got to
Oh,
talk about for the pelvic floor?
um, yes, the one thing, so in terms of the phrases that might go on my headstone, I would be remiss if we didn't talk about scar tissue, whether that's C-sections I've had to myself, or even scarring in the pelvic floor. And this is the first step that I take with all my patients. So the way I kind of put it together is phase one is your muscles and your scar, they all need to move the way that they're supposed to. They need to be soft and supple. And then once we get through phase one, then we get to go to phase two with strengthening. And for me, that's the fun part, because that's the part that if you're even semi-consistent with what I have you do, in 2 to 3 months, you're where you need to be. But phase one is probably the most boring. It's the one we have the least amount of control over, but it's the one that if we don't take care of it, you will try to spend the rest of your life trying to figure out that phase two, that pelvic floor strengthening, and never get anywhere. And the reason that I love to talk about this so much, and I feel like it needs to be talked about more, is any other muscle that we tear or has been cut through, you go to PT and there are different protocols that you have to reach before you can move on to the next phase of recovery. However, our pelvic floor, which remember does all these incredible things, after we have a baby and we've torn or we've had an episiotomy and been stitched back up, or maybe even not, we now have scar tissue, and at 6 weeks, okay, go ahead, like start running, start lifting weights. It's totally fine. Rather than realizing, okay, well, scar tissue doesn't always stay local. And I see it often where I call it the Elsa effect. I don't know if, I hope that's like not trademarked, but it's almost like Elsa does her little thing, and it's like that pelvic floor gets frozen. Once we get that scar moving, once we get that fascia moving, that pelvic floor, no matter how long it's been, and this is why my husband probably jokes, he hears me talk about it on stories or recordings or podcasts or I don't know. And that pelvic floor feels like a 6-week, an 8-week, a 10-week postpartum pelvic floor. So just even a couple weeks ago, I had a gal come in. Her youngest was 7. She's had 4 kids. I can't remember how old the oldest was. We got her scar to release that first visit, which I was so thankful for. And I start pressing, because I've been doing this for 13 years, that pelvic floor literally felt like an 8-week postpartum pelvic floor that I had just seen in my office a couple patients earlier.
Right.
All that was 7 years ago, even though she tore with her first, and I can't remember. So that pelvic floor has to move really well before you can start strengthening. So that would be the thing that I would say, if we missed anything, that's going to go on my headstone when I die. We need to work on the scar tissue. But if that doesn't quite make sense to people, your muscles have to contract or shorten and then relax and lengthen, or even lengthen more. And I know we're on YouTube and you have the podcast, but if you happen to see me at the gym and I'm doing like these tiny little mini squats, like I look like a geriatric grandmother, and you walk by and you're like, nice work, girl. And I say to you, yep, I'm really trying to build that booty. You probably would roll your eyes thinking like, well, you look like a geriatric grandma, which I love my grandma. She's not here, but I'm just saying, like, that's what it might look like. And you would wonder, what do you do? That's not going to build a booty. Are you kidding me? And if they happen to say that to me, I might say something, but hypothetically, well, what, I'm doing squats. And they would say, no, get deeper. Like, you have to go through that full range of motion. Your pelvic floor is the same way. It needs to go through that full range. And so if those muscles are tight because of trauma, or that scar tissue is literally allowed that pelvic floor to be frozen like Elsa, we're not going to get anywhere with that strengthening.
Got it. Okay, that makes so much sense to me.
Good.
And so since I work from a quantum space, the quantum biology, and the fascia is our quantum communication. So everything is moving. That the more coherence you have in the fascia, like I knew you were going to be like, oh, that's why it
Yeah.
makes so, like, to me, it makes sense to have step 1 For me, step one is always safety and stability in mental health. That stays
Oh,
right. And so I'm like, okay, this makes sense to me. In the pelvic floor, you've got to have it soft and supple. We have to work with the places that are frozen,
uh-huh.
create safety and like suppleness, right? So that then
Mhm.
you can start strengthening. So I'm the same way with like step two or phase two or whatever. For me, it's more fluid. I don't know for you if it's just we're still always kind of working on safety signals to the
Mm,
cells and
mhm.
helping like to make things more flexible so that you can do the deeper work. And to
Yeah.
me, I call that resourcing. So a lot of that is like nervous system help, but also things that are safety signals to our cells, like being in nature and earthing and on those kinds of things. So to me,
Okay.
helping your pelvic floor makes perfect sense that it would be creating more safety in your body so things can let go. And then this quantum communication can actually happen so that the
Oh,
cells are no longer in a danger response. So they don't need to like all the time. I
yeah.
mean, they tense when they're supposed to and they relax when they're supposed to, just like the nervous system like gets on it when we're in danger and then lets go when we're not. Like all of it has that same to me makes a lot of sense. Is that making sense to you?
Totally. I mean, what you're talking about, I have never heard it phrased that way before. But the way you phrase it just allows it to be so much more easily understood, which makes it, right. Like if I needed that help, I mean, I probably do. We all do, right? We all do.
Right.
That I would more easily buy in and understand, like, oh yes, okay, I see how that makes sense. Yeah, 1,000,000%. That makes so much sense to me. And it's very convincing that I probably need some work. I hope that is to everybody listening too, that we all need a little extra.
Right, we do because it's like, oh, well, what things can I do to send safety signals? And like having a good relationship with a PT that is helping with your pelvic floor. I mean, I can't think of anything more basic than your pelvic floor being supported and working with somebody that's really that you're connected with. I don't think there's anything any better for sending safety signals other, nature, even like images of nature send
Mhm.
safety signals to our body.
Sure, sure.
But also, just there are all kinds of things that can do that, but it's all about the fascia. So
Uh-huh.
I mean, that's the bottom line is that you want to have the scars in your body worked on.
The
So,
ones seen and unseen.
correct, the ones that are physical and the ones that are emotional, mental as well.
Sure,
Yeah.
sure.
Yeah, so I love this. So you help so many people. So I have to ask you, you've got little kiddos, you've got a lot going on. What do you do to help nourish your body, mind, soul? What really like nourishes you?
I love being outside with my kids. I feel like that is a really big one. Like you're talking about nature. I think that's probably why I love it. I love being outside and just being dirty and playing with them. But I also really love, I have a morning routine that changes depending on the season I'm in, but I typically try to have at least 30 minutes in the morning that I'm reading from my Bible or scriptures or a personal development book or meditation or maybe just even planning my day so that I'm ready to tackle everything. But I that's at least what's working in this season anyways, but
Yeah, I love the time with the kids outside because it will go by so fast.
I
And
know.
yeah, I mean, not that you can't do that when they're older, but it's not the
Right.
same. We're not
It's different.
digging
It's
in the dirt and oh, so good. I love that. Yeah, and I call it the power hour, the 30 minutes, the first 30 minutes of the day and the last 30 minutes before you go to bed. How
Oh.
important, people think of the power hour as the first hour of the morning, but I'm like, no,
Uh-huh.
it's morning and evening
Oh.
to like wrap up your day. And
Uh-huh.
so, yeah, so to because usually we're exhausted and fall into bed when we're parents of young children.
Yeah, I fall asleep probably most like nights with them when I'm like in bed for them. So I'm gonna try to be more intentional with that and notice the difference. Thank you for that. That's
You'll have
really,
to just
really great.
email me or text me and let me know how that goes for you, but
Yeah, I will.
because you're already in that mindset of, like, how important it is to, like, set your day
Mhm.
up, but also close your day out.
Oh,
So,
I
like,
like that.
sometimes people will do, like, a gratitude practice or something, and you don't have
Oh,
to do anything elaborate. It's just, the last 30 minutes, just being
mhm.
intentional about, like, what really nourishes me, what feeds my soul,
Mm,
and yeah, so whatever that looks like for you. Awesome.
okay, I'm
I
gonna do
love it.
it.
I've loved getting to know you. I can't wait to stay in touch and,
Yeah,
like, go back and forth with things as we learn, and yeah, I think it's very helpful to understand what you do. I think
thank
it will
you.
be very helpful for a lot of people and for therapists and people who work with people in other capacities to understand this. I think would be is huge. So,
Yeah.
thank you.
No, thank you for your time. I've enjoyed this. I've learned so much, and I'm very appreciative of it. Thank you.
Yeah.